for the insightful presentation. Now we have the privilege of hearing from a true pioneer in cardiac surgery, Dr. Zohair Alhalees. He will deliver a keynote address on the history of cardiac surgery in the Gulf region, reflecting on the remarkable progress and achievement that have shaped the field. Please welcome Dr. Zohair Alhalees.
Assalamu alaikum. Good morning, ladies and gentlemen. It's a great pleasure to be here in this inaugural meeting of the Gulf Society for Cardiac Surgeons, and I would like really to take this opportunity and congratulate the colleagues on establishing the society. I understand it takes a lot of work, sweat, and many hours, and it's really very impressive that within a year that you have been able to organize this meeting with such an attendance and hopefully high science quality. I'm just going to talk about the history of cardiac surgery in the Gulf region. I mean, this is really kind of fun thing to know, but I would like to say that without cardiac centers, without the investing in human capital, we will never progress. And that's why I would like to mention that the first medical school in the Gulf region actually was started in Saudi Arabia in 1969. And I was privileged to be part of that first-class graduate from the university. At that time, it was called Riyadh University, but then known now as the King Saud University. And actually, 2 years ago, we celebrated 50 years of establishing the medical school. And in the 1970s, medical schools opened in Bahrain and Yemen. Then Oman and the United Arab Emirates joined in the mid of the 1980s. And in 2002, the first medical college was established in Qatar. Just looking back at the history of cardiac surgery, in the early 1950s, the common saying was that open heart surgery is a great concept, but sick heart could not tolerate it. And this is one of the reasons you can see here in between 1951 and 1954. These are the cases that were done closing an ASD utilizing the heart-lung machine. 18 patients, 17 died and only one patient survived. It was a 5.5% survival. Can imagine how much progress was really established during that time. In 1952 to 1954, the concept of deep hypothermia was introduced, and Louise from Canada and colleagues operated on 60 patients with atrial septal defect using this concept, and 54 patients survived. Lily High in 1954 established the daring concept of cross-circulation, where a child with a ventricular septal defect was operated upon utilizing this cross-circulation using the patient's parent as a pump. So, interestingly, a total of 47 patients were operated using this technique, and 63% of them were alive 30 years later. However, all these fell out of favor and in favor of the heart-lung machine, which was developed during the same era. And we all know how much strides cardiac surgery have made since those days. We have now such operating rooms with all equipments are at our fingertips. Going back to cardiac surgery in the Arab world, in general, closed cardiac procedures were being performed from early days of cardiac surgery. Things such as PD ligation, closed mitral valve commissurotomy used to be a very common procedure, actually till recently in Egypt. And this is basically because of the problem of mitral valve stenosis related to rheumatic heart disease. And in 1958, actually, a secondary atrial septal defect was closed in Egypt utilizing surface cooling. But open heart surgery as such, utilizing the heart-lung machine in Egypt, started in the 1965. Lebanon was the 4th country in the world to perform open heart surgery. In April of 1959, the first open heart procedure was performed successfully at the American University of Beirut Medical Center on a patient with atrial septal defect and pulmonary stenosis. In the Gulf region, cardiac surgery practically started in the 1970s, though before that, sporadic cases were done by visiting surgeons, but these were mostly closed cardiac procedures. In terms of chronicity, the first as such cardiac center or cardiac surgical services were established first in Kuwait in 1971. And actually, prior to that, they used to have visiting surgeons doing mostly closed cardiac operations. 70% of the operations, however, at that time were coronary artery bypass grafting and about 20% valve cases. In Saudi Arabia, heart surgery practically started in 1975. In Qatar in 1983. In the United Arab Emirates in 1988, and this was in Abu Dhabi. And I think 4 years after that, started in Dubai Hospital in Dubai. In Oman, services started in 1990, and I must say, looking at the colleagues in Oman, the strides that they have made during such a short period of time were actually exemplary. Now they have even a dedicated heart center with a large number of adult and pediatric cases, and I understand even they embarked on very complex congenital cardiac procedures. In Bahrain, the center was established in 1992, and in Yemen in 2000, Al Thawra Hospital in Sana'a. And believe it or not, despite the difficulties that we're seeing in Yemen, there are at current about 6 centers that are actively doing some cardiac cases in Yemen. As usual, the beginnings were performing simple cases, and in many instances with the help of outside expertise. However, I must say with the vision of depending on locals, and I would say that's what I would say about investing in human capital. Gulf countries invested heavily in human capital, and through the scholarship programs, send their doctors abroad for specialization. Meanwhile, more modern and well-equipped hospitals with cardiac centers were built, and trainees from abroad started to come back, well-trained and enthusiastic to serve their countries. And there is no doubt that those elevated the level of cardiac care in the region to high standards comparable to any in the world. Standalone cardiac centers were built, offering the full spectrum of cardiology, cardiac surgery, including heart transplantation, circulatory assist devices in most of the GCC countries. Sending patients abroad became no longer necessary. And this was really a common practice in the 80s and in the 70s and 80s. Several important high-quality scientific meetings are held, attracting speakers and delegates from all over the world, and landmark contributions to literature are coming out of many centers in the GCC countries. Being from Saudi Arabia, I just would like to mention the Saudi Arabia story. Briefly, in 1975, a team was contracted from Loma Linda University in Los Angeles, United States. And the first open heart surgery procedures were performed in Khamis Mashiat, which is a city in the south of Saudi Arabia, at the Armed Forces Health Center in that area. And actually, through some visits, over 250 cases were done, and these were reported actually with only two operative deaths. Dr. Wiram was actually the leading surgeon for that group, And I must say that many of our surgeons are indebted to Dr. Weeram, because he, even after the center was opened up in Riyadh to do regular cases, he stayed behind and was coaching the young surgeons at the military hospital. The first heart center was also established at my hospital, the King Faisal Specialist Hospital in Riyadh, in 1978. Again, with the cooperation with Baylor, with United States, Baylor College of Medicine in Houston. And in 1979, the center at the military hospital was also permanently established. Was initially called as the Riyadh Heart Center, but then now is known as Prince Sultan Cardiac Center. At the time that the heart surgery was started at King Faisal Specialist Hospital, I was just a new graduate from the medical school, and I had the privilege of working with the team from there, doing cardiac cases at the hospital. This went on actually for quite some time, till about 1985, where actually the services were taken over by the local team. At the military hospital in Riyadh, a standalone heart center was built, and this was opened in 1993. The medical services at the Ministry of Defense also opened up many centers looking after cardiac patients in various areas of Saudi Arabia. Another center actually was established at King Fahd Hospital in Jeddah, which provided adult and pediatric cardiac cases, led by Dr. Hassan Rafa. And the first open heart surgery at that center was performed in 1981. This is Dr. Hassan Rafa with some children that he operated upon. And excuse me for a non-Arabic speaking in the audience, but Dr. Rafa actually used to say this before any operation. سبحان الذي خلق فأبدع والذي صور فأحسن والذي أنزل لكل داء دواء والذي قال ألا بذكر الله تطمئن القلوب. اللهم شافيه في من شافيت وعافيه في من عافيت. اللهم إني أسألك له ولقلبه كل الشفاء وخير الدواء يا من قلت ادعوني أستجب لكم. اللهم ربي استجب لهذا السؤال. And interestingly also, Dr. Hassan Rafa, as we all know, when cooling the heart, we use some cold saline. He used to cool Zamzam water and put it in the pericardium. In March 17, 1986, this was a landmark progress, actually, of cardiac services in Saudi Arabia. Dr. Muhammad Al-Faqih, who was actually a pioneer cardiac surgeon in Saudi Arabia, and he led many of the innovations in Saudi Arabia, performed the first heart transplant in Saudi Arabia, which happened to be to a child. Another heart center was established at the National Guard Health Services in King Abdulaziz National Guard Medical City in the year 2000. And all of these centers, at least I believe in Saudi Arabia, but I'm sure in all of the Gulf region, resulted in what I would like to call as healthy competition that in general led to the undoubted progress of cardiac services for adult and pediatric patients in the region. We don't grow when things are easy. We grow when we face challenges. We face the challenges, we meet them, and I believe that we grown up to a standard that is comparable to any part of the world. Thank you.